Good evening, students. In this session, we'll deal with the histology of the spinal cord. So, within the central nervous system, we are going to study three major structures. One is the spinal cord, the other will be the cerebellar cortex, the other will be the cerebral cortex. In this particular session, we'll be dealing with the histology of the spinal cord. Just before going to that, so this entire nervous system is consisting mainly of gray matter and white matter and supporting blood vessels. So what is present in gray matter? Cell bodies of neurons, dendrites, initial unmyelinated part of nerve fibers, it is axons, then neuroglial cells. These unmyelinated fibers of gray matter makes it appear gray. So white matter, myelinated fibers, neuroglial cells and few unmyelinated fibers. Blood vessels are present in both gray and white matter. Cerebrum and cerebellum, the organization is different. Like there is superficial cortex, which is gray matter, then deep white matter, and deepest core of gray matter. So, which is the subcortical gray matter, like basal nuclei of cerebrum and deep cerebellar nuclei. Whereas in primitive nervous tissue like spinal cord and brainstem, you can see there is central gray matter and peripheral white matter. Fibers arising in one gray mass and in other gray mass. So the way the fibers connect two gray masses are named differently, like they'll be labeled as tracts and funiculi. You can see here anterior, lateral, and posterior funiculi of spinal cord. Fasciculi, fasciculus gracilis and fasciculus cuneatus, which is the dorsal column pathway. Lemnisci, medial lemniscus, lateral lemniscus, trigeminal lemniscus, and spinal lemniscus. And pedicles connecting cerebrum and cerebellum to the brainstem. So if we come to the basic structure of spinal cord, there will be a central gray matter and peripheral white matter. So if we come from outside inwards, you can see three meninges are there: dura, arachnoid, and pia. So few important pial modifications are there, like filum terminal, linea splendens, then ligamentum denticulatum, which is the most important. Then you can see here there is central gray matter. So it is present in the form of H shape. Anterior gray horn, which is motor, posterior gray horn, which is sensory, and lateral gray horn, which is autonomous. It is present only in the thoracic region and upper two lumbar segments. So gray commissure is present with central canal, which is lined by the ependyma, which is ciliated columnar epithelium. Then white matter is divided into anterior funiculus, posterior funiculus, and lateral funiculus, and there is ventral white commissure. So anterior median fissure, posterior median sulcus, and posterior median septum will divide two halves of the spinal cord in any section. You can see here. So this is the dura matter, this is the arachnoid matter, and this will be the pia matter. This is the posterior median sulcus, and this will be the posterior median septum. This is the gray commissure, this is the dorsal gray commissure, this is the ventral gray commissure, this is a central canal lined by ependyma, this is the anterior median fissure. And you can see here, this is the posterior horn, this is the anterior horn, this is the lateral horn of the gray matter, and this part is the anterior white funiculus, and this is the lateral white funiculus, and this is the posterior white funiculus. This is the basic structure. Now we'll go ahead and deal with how the spinal cord appears at different levels, like cervical region, thoracic region, lumbar region, and sacral region. Before entering into the regional microanatomy of spinal cord, just to have a magnified view, see, this is the white matter where you can see this axons. These are the axons surrounded by the endoneurium. So this is representing the tracts, ascending and descending tracts in the white matter. Here you can see within the gray matter, you can see the multipolar neurons. So this is the gray matter and this is the white matter. This is the basic structure. So cervical region. So gray matter is having a ventral horn which is bulbous and broad, whereas dorsal horn will be slender. Lateral horn is absent. So white matter is abundant because it is receiving all the fibers from lower limbs, pelvic region, abdomen, thorax, and upper limbs. Cross section appears oval. Position of the central canal is ventral. You can see this is the section of spinal cord at cervical region. See the abundance of the white matter. The ventral horn is bulbous, whereas dorsal horn is slender. And you can see the position of the central canal is ventral. So you can see the multipolar neurons in the gray matter, and you can see the bundles of nerve fibers. In the thoracic region, the gray matter is like ventral and dorsal horns both are slender. Lateral horn is present, the autonomic component. White matter is abundant. Cross section is round and small. Position of the central canal is ventral. You can see here. So this position of central canal, it appears almost like it is a center, but there is slightly deviation to the ventral side. Dorsal side is still longer than the ventral aspect in relation to the central canal. And you can see the thin dorsal and ventral horns, and you can see the presence of the lateral horn, and see the white matter is abundant. In the lumbar regions, again ventral and dorsal horns are bulbous and broad. Lateral horn present only in the upper two segments. White matter is comparatively less when we see in relation to the thoracic region and cervical region. Cross section is oval. Position of the central canal almost lies in the midway between dorsum and ventral aspects. You can see here, this is the central position. You can see the bulbous posterior horn and bulbous anterior horn. And this is the white matter, which is comparatively less with respect to thoracic and lumbar regions. And coming to the sacral region, ventral and dorsal horns are bulbous and broad. Lateral horn is absent. White matter is least. So out of cervical, thoracic, lumbar and sacral, white matter will be least in case of sacral region because it will be receiving only from the perineal part. Then and also few fibers from the lower limb. So cross section will be round and very small. Position of the central canal is dorsal. You can see here. So this has slightly gone dorsal. The central canal has slightly gone to the dorsal aspect. White matter is minimal. The gray matter is maximum here. Both posterior horn and anterior horn are bulbous. So you can see the change in the distribution of gray matter and white matter from cervical region. See how much it is oval. Then it is round and small. Again, this is also round and small. And again, here it is oval. And see the increase in the gray matter. So in the cervical region, if you see only the ventral horn is bulbous. In thoracic region, if you see both dorsal and ventral horns are slender, even lateral horn is present. In case of lumbar region and sacral region, both dorsal and ventral horns are bulbous. So this finishes with the histology of the spinal cord. Thank you.